702.
The Naked Scientist.
It's time for The Naked Scientist with Dr. Chris Smith. Happy Monday. How are you doing?
Oh, hello, Lebo. I'm very good. How are you?
I'm doing fantastic. I just was wondering, as John Pullman was sharing that, girls perform better than boys in maths. I was curious as to what the latest research you are aware of says. Is it the girl brain or the boy brain that is better at maths?
This is a minefield, this one, isn't it? But the evidence is that
Yes.
it's all a spectrum, to be honest with you. There are people in the population who are female who are much better than people in the population who are male at maths. There are people in the population who are male that are much better than females at maths. So when you draw those two spectra with a range of abilities, you generally find that on average, the male average sits slightly above the female average for certain skills, including certain mathematical skills. There are other things that we do psychologically, such as if you think about three-dimensional visualization or map reading, that kind of thing, that on average, men find this sort of task easier than women. But then you do tests like you say, right, I want you to generate as many words as you possibly can, beginning with the letter P in 30 seconds without repeating any starting now. Women, on average, will outperform men at that task. If you show people a bunch of faces and you say, I want you to generate words for what the emotions being displayed in these faces are for each of these faces, women will always score more highly and more accurately than men on average. So it all comes down to the fact that there is a range of abilities and it's where the average sits in relation to the two, but it's not an absolute thing. So you can't say, I have an X and a Y chromosome, I'm male, therefore I'm better at maths than you. That just is not how it works. But on average, if you take a person on average from the population at random, you may find, if it's maths you're considering, men tend to be better at certain aspects of maths than women, but there are other skills that women will outperform men at. And I think this is partly a reflection on the fact that one of the reasons why humans are so successful is we are a social species and we have skills that complement everybody else and each other. And in the same way that it takes a man and a woman to make a baby, you can't just do that if you wanted to yourself. You need those complementary bits of biology and skills, and nurturing a family successfully, you need complementary skills. I think it's all part of the same sort of thing, and we've evolved to have skills that complement. When we're in a social group with roughly equal numbers of men and women, the strengths of one group can make up for some shortfalls in another and vice versa.
Okay, thank you so much for that, Dr. Chris Smith. Let's go to the lines. Lulu in Randfontein, go ahead.
Hi, doctor. I'd like to ask advice. They put in a pacemaker into my body. The first pacemaker had an infection. Then they took me to the plastic surgeon. He redid it. As I'm sitting now here, doctor, it is paining like needles. And it got blisters on top, but they're not open. It's just paining and pricking like needles. What is wrong with the pacemaker? Is the pacemaker working with me or not? Doesn't it work with me?
Oh, that's a tricky one, Doc. If a pacemaker is starting to feel painful?
Hi, Lulu. You don't say exactly when they put this into you, but if the pain and the discomfort started shortly after it went in...
We can ask her, Lulu,
okay.
How long ago did you get that pacemaker in?
It is now 3 weeks. They redid it all over again.
Yeah,
so
okay.
3 weeks from them redoing it.
The fact that this symptom has happened shortly after the insertion of the device strongly argues that the two are linked. You can't say 100%, but it's almost certain, isn't it, that if you've got something that starts in the same place after you do something to that bit of the body, they're probably linked. Now, pacemakers are really important. Their role is to regulate heart rhythm. And you need one if your heart isn't beating at the right rate itself. And the way a pacemaker works is that you put a device, which is a source of electricity, in under the skin, and you thread a wire in through one of the blood vessels nearby, which goes usually into the vein, which runs across the area where the pacemaker is, into the bottom of the right-hand side of the heart, and the electrical contact there touches the heart muscle, and when the pacemaker fires off an electrical discharge, this is picked up by the heart muscle, and the heart muscle then follows the rhythm of the pulses arriving from the pacemaker, and in this way it regulates your heartbeat because it spreads from the point you excite the heart all over the heart muscle from the bottom towards the top, and the heart beats in a nice even way that way. And this is very useful because if people do not have the right heart rhythm, then they feel very unwell. Usually their heart's going too slowly, and this leads to a state of feeling extremely lethargic and tired because you're effectively in heart failure. And as soon as you've got the pacemaker working properly, then this helps to reset the rhythm to what it should be, and people feel much, much better. So pacemakers are really good, they're really important, and they're really useful. But because you're putting a foreign object into the body, then there is always a risk when you put a foreign object in under the skin. You're breaching the defences of the skin, and you're putting something which may either by virtue of the fact you've got a breach in the skin, allow infection in or be infected at the time it goes in. Surgeons should be extremely careful to make sure that doesn't happen, but infections do happen. It's an unfortunate, really, it's a common side effect of surgery. And if you've got pain where it's gone in and the skin isn't healing up and you have discharge or redness or the fact that it's hot over the area where the pacemaker is, if you have any of those features, it really needs to be looked at. And the fact that you're saying you went back to a plastic surgeon and they had to do a reinsertion of this, I think you said plastic surgeon, but you went back and saw somebody, it may well be they pulled it out because it's infected. And the problem is we cannot shift infection very easily at all from foreign bodies inside the body because it's not your own anatomy, it's not your own tissue. It's really hard for the immune system to work properly on a foreign object and to clear up infection that shouldn't be there. So sometimes the only solution if you have got an entrenched infection is you have to take the thing out, the foreign body out, and then replace it later when the infection's been cleared up. But this needs looking at, and you must make sure you get someone to look at this and review it and check that it's been adequately covered with antibiotics, etc., and they're the right antibiotics. Someone has taken a swab, looked at what the microbes are that are doing this if it is an infection, and then fixed it with the right antibiotic cover. But you should prepare yourself. If there is a bad infection there, they may have to remove that pacemaker and might have to repeat the process once they've cleared the infection up. I hope not, but that would be my guess, and I would get it reviewed, please.
Thank you so much, Lulu, for your question, and I wish you all the best on getting that one resolved. Your voice notes on 07270211702.
Hi, my name is Rania, and I'm from Fourways, and I'm 10 years old. And my question to Dr. Chris is, how do wounds heal naturally?
Oh, hello, Rania.
Nice one. Thank you so much.
Yeah, this is lovely, and it's very relevant to the previous question, isn't it? And the answer is that when you have a breach in your skin, a wound, then the body can sense that there is damage there. And in fact, there is an electrical signal. The base of the wound has a voltage compared to the edges of the wound. And we don't know exactly how this happens, but it's to do with the way that cells respond to inflammation, and then they pump out charged particles called ions, preferentially of one type over another, and this can create a voltage. So the edges of the wound are at a different voltage to the bottom of the wound. And cells at the edge of the wound grow very, very fast, and then they follow the voltage signal to work out where the bottom of the wound is, and they grow in from the edges down towards the bottom, filling up the hole in order to fix the wound. So that's how the wound repairs itself. But in the immediate aftermath of a wound, the other thing that happens is you often burst blood vessels or cut through them, and this causes bleeding, obviously, and that quite quickly stops. And it stops, thank goodness, due to small things called platelets, which are tiny bits of cells that circulate inside your bloodstream, and as soon as they see the outside world or the outside of a blood vessel, these activate and they change shape and they become all spiky and sticky, and they glue themselves all over the hole, and that blocks the blood vessels up. So that happens very quickly and stops bleeding, and then the wound starts to heal by the way I've explained, with cells sensing the voltage between the bottom and the edge, growing very fast and then flowing down into the bottom of the wound to fill it up from the bottom up towards the sides. And it slowly fills in with new cells, lays down new tissue to connect everything together, and then pulls everything tight. And then the process of remodelling begins, where the tissue is laid down in the right way so it's not all haphazard, and makes a nice neat repair which is nice and strong and hopefully won't break open again.
This one is on the WhatsApp line and it says, I noticed when I sleep less or when I oversleep, I get serious pains in either of my eyes, more like a migraine in either the left or the right eye. Please, what does your say about that, doctor?
Oh, that's an interesting one, and I've no idea. I'd have to think about that. I think I've not heard anyone say that before. I mean, when you are very tired, it does make you feel stressed and tense, and so this could be a tension headache. Similarly, if you oversleep, sometimes that can also make you feel a bit woozy and not very well the next day, and so you again can get sort of tension headache. So it might be that. But let me have a think about that and maybe come back next week with anything I find, because I've never thought about that and I've never heard anyone say that to me before. So let me have a think about it and I'll see what I can come up with.
Thank you so much for that question. We go again to the line. Zandi in Sandton, go ahead.
Hi, Dr. Chris. Thank you. I've got this pain at the back, bottom part of my left-hand side, and I'm scared that it could be kidney failure. I have no other symptoms. Could it be?
Ma'am, did you use Dr. Google to find kidney failure? Ma'am,
Probably so.
I'm going to give you a hiding on your hand, doctor.
Well, the
Doctor,
first thing
if
is
she
that
did have kidney failure,
I-
would she be able to talk to us?
the first thing is I don't do on-air diagnosis, okay? So anything I say on this and other
Yes.
programs is just for general information, because I'm not your doctor and something might be missed, and it's dangerous to just take what I say without me having any opportunity to review this properly and have a proper chat and a look. So this is just general information. Kidney failure often is painless. And people will present with really bad kidney failure, and the first thing they know is when they've got other secondary problems. It's one of those things that creeps up on you. It's a bit like high blood pressure, and often, in fact, high blood pressure can cause kidney failure in the long term because it damages your kidneys for progressively over a long time. And this is quite common, in fact, in people with diabetes. A combination of factors, including high blood pressure and diabetes, will cause progressive loss of kidney function. But what does cause pain, which is usually over the loins, and the loins are if you were to stand with your hands on your hips, where your fingers are pointing to around the back, that's where you feel pain in your kidneys. And the commonest cause in women is often an infection. And I say women because women are more prone to getting UTIs, urine infections, than men are. And they can occasionally become significant and severe enough to spread up from the bladder, which is normally where you have symptoms and problems with a UTI, up the tube from the kidney to the bladder, and they get into the kidney and they can cause kidney infection. That's called pyelonephritis, and that's very nasty, and people who've got that will usually feel extremely unwell. Not only will it be painful, they may pass blood in the urine, but they will often be having what we call rigors. They'll be shivering and shuddering because they're shaking with a high fever. And you sound a bit too well on the radio for that to be the case. So I think that's very unlikely. The other reason people get pains in their kidneys is if they've got stones. And this is very, very common as well. And for various reasons, over a lifetime and different ages, but usually in people who have a poorer diet or smoke, actually. Smoking is a risk factor. You can get builds up of calcium and other materials in the kidneys. And this can also be a consequence of infection as well, actually. But you can get stones, kidney stones, and these, if they stay put, can be without problem. But sometimes bits of the stones can break off and they begin to move. And they can become excruciatingly painful as they find their way out of the body. So if you have gripey pains in that sort of area that become a new thing, and it's bad enough to make you think, oh, this is really quite serious and it's severe and it's interrupting my day, you must get that looked at, because that may well be what is going on. And it would depend on age, family history, and other health problems and history of health problems as well. But that's hopefully a range of all the reasons why you would usually most commonly get pains in that part of the body.
Thank you so much, Zandi. Wish you all the best. Please go seek medical attention. We cannot give advice over radio. There are too many personal questions that would need to be asked and factors that would need to be considered. Leslie in Randburg, go ahead.
Sure. Hi, Relay. Quick one, doctor. I'm a runner, and I twisted my ankle once on some sort of a pothole, and I've since been experiencing this sharp pain underneath my right heel when I'm stepping on the ground. But now the funny thing is, when I run a longer distance, that pain sort of goes away. So I'm not sure if it's what it is and how I can sort of work around it.
Mm. That's an interesting one as well. I mean, there is something called plantar fasciitis, which is when the tendon, which is part of the arch of your foot, becomes painful and inflamed. And this can happen for a range of reasons. Sometimes trauma can kick that off. And it might be that what you've got is where you injured yourself and things stiffened up, and then you start running and it takes a little while for things to loosen up again. Also, sometimes when you've got these sort of pathological fractures, shin splints, people often say that the legs are quite painful when they first start running, but then after a while things seem to warm up and the pain can subside a bit. It might be you've been overdoing it, because it's very important if you do injure a body part, you must keep it active and mobile. You don't want it to get stiffened up, but at the same time you have to give things a chance to heal up properly, because you can actually compound the damage and make it worse than if you'd not been doing this at all. So if it's something which is a new thing and it's only just happened, try simple things first, just things like painkillers first, and taking it easy for a little while. If this has been going on for a while, it's probable that something is badly wrong, and you need to get this looked at, because it may be that you're compounding an injury and that something needs to be, you need to do something to get it fixed. So I would really use time as the best guide. Recent problem, you can attribute it to your twisted ankle. Take it easy for a little while, try some simple painkillers and keep it mobile, but reduce the amount of the intensity of the exercise. If this is a chronic problem, you should seek some advice, because you don't want to make that worse.
Oh, thank you so much, Leslie. Wishing you all the best with that injury. Dr. Chris Smith, you have your homework. I expect
do.
it done timeously till we meet.
I'm going to go and think about headaches and sleeping too much. So not a problem I have, but I'll see you next week.
Yes, good to know. Dr. Chris Smith, the Naked Scientist.
702. The Naked Scientist.